Welcome to another episode of Muscle IQ Education with Dr. Chris Knudsen from Muscle IQ Physical Therapy in Provo. Today we are going to review a research article that's published online. We'll go ahead and click on this tab. So here we are at the U.S. National Library of Medicine, National Institutes of Health. And this article was originally published in the Journal of Multidisciplinary Healthcare. This article is entitled Clinical and Symptomological Reflections, the Fascial System, by Bruno Bordoni and Emiliano Zanier. And in this article, it summarizes what is known from research about fascia. And some of the researchers most quoted in this article are Carla Stecco, Helen Langevin, and Robert Schleip. And in this article, I like to point out here in the bottom of the abstract, they say, in our opinion, knowing and understanding this complex system of fascial layers is essential for the clinician and other health practitioners in finding the best treatment strategy for patients. In the introduction, we're going to go down here, and it says, every body structure is wrapped in connective tissue or fascia, creating a structural continuity that gives form and function to every tissue and organ. We're going to watch a little video clip that talks about the research that Carla Stecco made.
Carla Stecco's research on fascia has helped reveal what we know today. Fascia exists everywhere in the body, in many shapes and consistencies. Directly beneath the skin is the surface fascia. The deep fascia envelops our muscles, and also our muscle fibers, like the skin around a sausage. The fascia also envelops our organs in a whitish skin. Even the brain is protected by this tissue.
Okay, so in this video we see fascia is a connective tissue that surrounds our entire body. It's equally distributed throughout the entire body, enveloping, interacting with, and permeating blood vessels, nerves, viscera, meninges, bones, and muscles, creating various layers at different depths and forming a tri-dimensional metabolic and mechanical matrix. We're going to go ahead and scroll down here a little bit more. So there's different layers in fascia. A lot of people have never really researched much about fascia, but there is a little bit of research done. Recently, there have been some researchers who've done photography or videography of the fascia inside the human body. And let's go ahead and watch a little video clip here. Inside the body, looking at fascia magnified at 25%.
How are these structures organized? How do they resorb and move, and what role do they play? To use the jargon of physical mechanics, the arrangement can be termed a complex one, completely stable and in search of equilibrium. A system with tremendous capacity to resist and adapt to change. For physicists and doctors alike, there is no other such entity with so much cacophonous movement on the microscopic and macroscopic level.
Very much web-like. Going back to the article, we're going to scroll down here to symptoms, facts, and hypotheses. And scrolling down here, the muscle system is part of the fascial continuum. And when it is affected by pathologies, such as disorders such as visceral, genetic, vascular, metabolic, and elementary disorders, its function undergoes a non-physiological alteration. There are many epigenetic processes that can lead to its adjustment as a response to mechanotransductive stimuli, resulting in further decrease of its function and properties. Fascia, it goes on to say, an increased level of circulating cytokines and originating in the connective tissue symptom due to systemic pathologies could develop neuropathic pain. It talks a lot in this article about how fascia is tied with pain, that fascia actually plays a big role in muscle pain, body aches, stiffness. There's also a section here Reduced sliding of the various layers limits the functionality of the endocannabinoid system. There is a close relationship between the endocannabinoid or endorphin system and the fibroblasts. This relationship is believed to better manage any inflammation and pain information originating in the fascial tissue, as the fascia undergoes continuous remodeling during the day. We're going to scroll down here a little bit more. Defective sliding, for instance, due to scar tissue, generates anomalous tension, which then affects the fascial continuum, developing painful symptoms. Tensional alterations can derive from the contractile property of fibroblasts, creating a fascial tonus that is independent of neurological intervention. As we scroll down here, it talks about more about how fascia plays a significant role in the generation of pain in our bodies. Let's go ahead and look at the importance of the thickness of fascia and pain on this next video here.
As we can see from an ultrasound picture of an arm, the fascia is arranged in layers. When we move, they slide back and forth. This also applies to the fascia in the back. In her research comparing the tissue of people who suffer from back pain with that of people who don't, Langevin has discovered that the difference lies in the connective tissue's ability to slide.
In normal people, we have two layers like this, and they should be able to move by about 75% of their length when the back moves. And then we know that in people with back pain, it's reduced to about 50% of their length. So we know that there's a reduction in the amount of sliding that occurs between layers.
Like her German colleague Robert Schleip, Langevin believes the cells of the connective tissue are responsible for this. Whenever they produce too much collagen, the sliding becomes more difficult.
Okay, so anytime the fascia thickens, it can decrease the amount of sliding, and that sliding can lead, the inability to slide can reduce muscle contraction and can also cause pain. We're going to scroll down here to another section in this article. Research has proven that patients who suffer from chronic lumbar backache present an inflammation of the local fascial area and experience degenerating variations of collagen fibers and microcalcifications. Besides, a 25% increase in thickening of the perimuscular fascial tissue if compared with non-suffering subjects. So basically what this says is that fascia in people with low back pain is 25% thicker than the fascia in the low back of people who don't have any low back pain. So we're going to watch another video, this one with Robert Schleip, one of the researchers in this article on fascia.
Too much collagen can also be harmful. Schleip and Klingler have studied how the tissue in an arm changes when it's put in a cast after an injury. Their study confirms that exercise is extremely important for the fascial tissue.
After 3 weeks in a cast with no movement, the tissue in the arm has begun to overgrow.
Picture A on the left shows healthy, undamaged tissue before the arm was put in plaster. Picture B was taken 3 weeks later. The change in the tissue is unmistakable. It has become matted, the structure thicker and chaotic.
The data we've obtained show quite clearly that a lack of exercise results in overproliferation of the connective tissue structures, and thus in a loss of function. This is the decisive discovery. It means that exercise is essential for maintaining our fascia.
So again, these researchers have shown that fascia can thicken up, and in patients with low back pain, chronic low back pain, a lot of times this fascia is actually 25% thicker than in patients without low back pain. And these researchers found the same thing happened if they immobilized somebody's arm and put it in a cast for 6 weeks. The fascia ended up thickening up, creating a problem. So I'm going to go ahead and end this video here. We'd like to thank you for watching this video. If you liked this video, please click the like button. If you'd like to see more videos like this, please subscribe to this channel at Muscle IQ Physical Therapy. Also, take a look at our website at www.muscleiq.com. Thanks for watching, and we'll see you again next time.